Welcome to the initiative of Center for Science and Environment on the occasion of the World Antimicrobial Awareness Week 2020. CSE is a non-for-profit public research and advocacy organization based out of New Delhi, India. I am Rajeshwari Sinha from the Food Safety and Toxins team here at CSE, where we've been working for almost a decade now on the area of antimicrobial resistance, which we all know is a global public health threat today. As part of our work, we've been focusing on the antibiotic resistance part of it, and particularly the animal and environmental aspects of this problem. This conversation that we are going to do today is a part of our initiative for the World Antimicrobial Awareness Week, which is entitled Act on AMR. And as part of this, we are engaging with global experts around the world to understand their thoughts and what they have been doing in order to address this grave issue. And today we're going to talk a little bit about global governance and global policymaking and understand whether the current efforts towards global governance and global policy making is enough to be able to address AMR, particularly at this point of time. And to tell us more on this, we have with us Dr. Anthony So. Very briefly, I'm going to introduce Dr. So, and then we're going to have this conversation with him. He is the professor of the practice and also the director of the IDEA Initiative. The IDEA Initiative is the Innovation and Design Enabling Access Initiative at the Department of International Health in the Johns Hopkins Bloomberg School of Public Health. Dr. So wears multiple hats, where he's also the director of the Strategic Policy Program of REACT, or the Action on Antibiotic Resistance, and he also leads a coalition of civil society organizations called the Antibiotic Resistance Coalition. Thank you very much, Dr. So, for joining us and agreeing to do this with us. We are really pleased to have you on board, and we extend a very warm welcome to you.
Well, I'm so delighted to be here, and particularly to join CSE on this occasion. You're one of the strongest partners, of course, in the global effort to turn back the tide of antimicrobial resistance. So it's really a pleasure to be here and to join your audience.
Right. Thank you so much, Dr. So. Without wasting much time, I think we should quickly go into the discussion and hear more from you. The maximum we can get out of you is good for us. And to begin with, you've been someone who's not only been following the global governance and policy-making process, but has also been an integral part of it. So what has been your experience and what, in your view, has been the real progress so far? And also, if you could mention what has been the challenges in this entire process of global governance and policymaking.
That's a great starting point. When we look back at the last 20 years, we've come a long distance. Back in 2001, WHO, the World Health Organization, had readied the launch of a new global strategy for the containment of antimicrobial resistance. But unfortunately, the timing of its release could not have been perhaps less propitious. They had actually decided to announce their new strategy in the Washington Press Club on September 11th, 2001. As you can well imagine, when the plane that crashed into the Pentagon, the press conference was canceled, and in many ways, the progress at that point in time seemed frozen. And it took us much of the decade that followed to really rekindle interest at the global level and to bring it from the backwaters of global health to the point actually where in 2016, antimicrobial resistance became the fourth issue only in global health ever to reach before the UN General Assembly, a year when they adopted the UN high-level political declaration on antimicrobial resistance. So real progress has been seen in terms of policymaker awareness over the last 15 to 20 years with the UK Commission on AMR, or antimicrobial resistance as we call it, reports from the OECD, the German government, the US President's Council of Advisors in Science and Technology, and many other venues. And important at the intergovernmental level, we've seen, of course, a global action plan on antimicrobial resistance. And many countries have adopted national action plans on antimicrobial resistance, or AMR. The tripartite agency, the World Health Organization, the Food and Agriculture Organization, and the World Organization of Animal Health all have come together to work on these issues. And importantly, of course, in the last few years, we had the UN Interagency Coordination Group on Antimicrobial Resistance, which brought forward recommendations to the UN Secretary General to address this challenge. We've also seen movement in areas like, for example, novel classes of antibiotics coming forward. But we still have a lot more work to do. Even there, where there have been some investments, we have yet to reap some of the gains we need to see in replenishing novel classes of antibiotics. And most importantly, I think where CSE has been really central, we've all seen the recognition of AMR as an intersectoral issue, a One Health issue that cuts across, of course, this environment, food systems, and healthcare delivery. But there are huge gaps and challenges that remain. Recommendations both at the global and national levels have really not been followed by funding commitments. Talk is cheap, action takes more. And the menu of options is vast, but the compass, the priority setting that we need to provide the globe is wanting. And so while we actually have an emerging effort to monitor and track across the tripartite agencies and even at national level some of these challenges, we still struggle to actually obtain the data, to really put in the metrics and measures to hold accountable, of course, stakeholders so that we can make progress against this global health challenge. We clearly need also more investments in novel approaches. And we have focused, of course, a lot of the innovation on technologies in human medicine. But outside of drugs, we've not seen the gains we want in diagnostics or in vaccines. We've not, of course, actually also had the innovation we need in food animal production practices that would shift us away from over-reliance on antimicrobials that we could better use in human medicine rather than actually in growth promotion or productivity gains in bringing food animals to market. And most importantly, of course, the biggest change is this year's, of course, central news story, which is COVID-19. It has both provided us challenges and opportunities at the same time. Challenges like the overuse of antibiotics in treating our patients, understandably, for sometimes obviously symptoms that we can't fully necessarily know are not also bacterial in origin. So you do see perhaps an overuse of empiric use of antibiotics in these patients. Importantly, our vaccination, of course, schedules for children have been disrupted. And many of those vaccines help, of course, decrease the unnecessary use of antibiotics by preventing things like the presentation of diarrhea or pneumonia to the clinical setting. And so we have these challenges, but at the same time, with that crisis comes opportunity, right? There are multiple points along the entire actually chain where we can actually intervene both on COVID-19 and on antimicrobial resistance. The transmission, of course, of diseases from animals to humans, what we call zoonotic disease transmission, the surveillance, the use of actually point-of-care diagnostics, infection control and prevention in our hospitals, in our workplaces, and so on, right? The lack of running water, which remains, of course, a core actually challenge, not only for AMR, but obviously, importantly, also for controlling hand washing, antimicrobial COVID-19 concerns, and obviously bringing forward the commodities we need to address, of course, these concerns. So these are many of the ways in which, of course, we have to address both actually the challenge of the day, which is in many ways the tsunami of COVID-19, as well as the rising tide of antimicrobial resistance.
Right. Thank you so much, Dr. So for delineating point by point these challenges. And I understand that with COVID-19, becoming a reality, this has become all the more difficult. But at the same time, we cannot ignore the issue of antimicrobial resistance, which was...
Sorry about that.
No problem, that's fine. So like I was saying, with COVID-19 around the corner, we also cannot ignore the issue of antimicrobial resistance. But while we speak of this, and as I said, that you wear multiple hats, and one of them is your engagement with this coalition of civil society organizations from across the world. You've been leading it for quite some time now. And what has been your experience, and how do you see the role of civil society as well as the Antibiotic Resistance Coalition in this process of global policy making?
The Antibiotic Resistance Coalition, to which CSE is a really important member, was founded in 2014, a really diverse coalition of groups working across different sectors, health, food systems, and environment. And it's really been impressive in terms of the breadth and bench of expertise that they bring, the best of civil society, to these intersectoral challenges of antimicrobial resistance. Together we've issued joint statements, responded to public consultations, have actually addressed in many ways the draft recommendations of the UN Interagency Coordination Group on antimicrobial resistance, and even advocated this past year for, of course, the only AMR specific indicator to track the progress of the Sustainable Development Goals along this particular dimension. And so importantly, I think that this particular coalition, I think, has a remarkable role to play. And over the last few years, of course, we've been very responsive to the rapidly changing landscape as intergovernmental agencies have actually stepped up to take a greater role in tackling this challenge. But I think the movement is in many ways tiring of recommendations being put forward, but not seeing the political commitment and the financing to see these proposals further. And so I think there will be a shift in the coalition's efforts, where we will focus on a more proactive agenda in lifting up areas for change and setting up new indicators for monitoring milestones for progress. And we see the opportunities for that in a wide range of areas. And it begins, of course, with the challenge of the moment, which I think civil society is so attuned to, that the convergence in tackling the challenges of antimicrobial resistance and also of COVID-19. That's a great place to start, because from zoonotic disease transmission to surveillance, we see there obviously a convergent agenda. And that's, of course, where monies are flowing in national action plans, in the global, of course, health arena. And importantly, there are new infrastructure that we can put into place. And there's also infrastructure we can build on in the past. Let's take one example that's probably very close to the heart of those who work with CSE. How do we monitor the environmental, indicators of this? Sewage monitoring, for example, is a great example. We know that now studies suggest that the resurgence of COVID-19 might potentially be flagged by the appearance of COVID-19 virus in the sewage. We've also know that in our circles of antimicrobial resistance, that people have thought about using the sewage systems as a way of monitoring for the emergence of new drug-resistant pathogens, new bugs, superbugs that might emerge. And importantly, of course, and interestingly, for years, the polio virus efforts have also monitored sewage. So you can see in this area of emerging infectious diseases, we can build a common infrastructure if we're strategic. And we take these opportunities to, in fact, advance the common cause that would address this challenge as well as related ones. There are lots of areas too in food production where we can see, in fact, new efforts. Much of the focus has been understandably on food animal production, where pork, beef, poultry have seen the unnecessary use of antimicrobials, particularly for growth promotion and prophylaxis or prevention of disease, without the evidence, of course, of the diagnosis of disease in the animals, which of course we would want to see treated appropriately with antibiotics if necessary. But it's the inappropriate use of antibiotics that drives the largest volume of use in that sector. But now we're seeing something also interesting. We're seeing, in fact, that documentation of the use of antimicrobials in crops. For example, in rice production, and in South Asia, in particular, rice. And so one of the questions I think that we need to start really extending the lens of our work is to really see where in the non-human areas are we using unnecessary amounts of antimicrobials so that we can protect its value for human medicine.
Right.
Another great example would be, of course, salmon production. And 95% or so, roughly, of the world's use of antimicrobials in salmon production is in Chile. And it's not because, of course, they have not struggled with the issue. They have a disease to treat there, which is challenging. But we have not developed, for example, new technologies that might, in fact, reduce their need to rely on antibiotics to tackle this bacterial illness that causes their salmon production to be, in fact, blemished, because it creates sores and so on the surface skin of salmon crop that they try to harvest for markets abroad. So it's a common cause there, where if we could develop a vaccine, much as, for example, for other diseases that salmon suffer in other parts of the world, if we could find the right technology there, we could reduce that 95% use to the negligible amount that is being used in other salmon aquaculture operations in the rest of the world. So we do need to find global coordinated action in some of these areas. And of course, as CSE knows, environment, the effluent that comes, antibiotic pollution that comes out of pharmaceutical manufacturing plants. But perhaps equally importantly, we need to be attentive to all the downstream antibiotics that flow into our environment. It's not just drug manufacturing plants. We know that much of the antibiotics are consumed by humans and animals are in fact excreted into the waste stream, straight into the environment. Up to 80%, depending upon the type of antibiotic and the particular species, is excreted directly into the environment rather than actually being used by actually the human or animal. So this is, again, an important source of hotspots or reservoirs of drug resistance that we need to tackle more holistically. So there's a lot of ground to cover.
Right. So I understand as part of the ARC, you've been delving into each of these areas and taking necessary issues to the level where they must be talked about. But if I can ask one small question is this engagement of civil society and the importance of civil society. Do you think that this has evolved over time in terms of the global bodies which have been engaged in policy making? They have also come up, with open arms and engaged with the civil society and recognized the importance of them as watchdogs in this area.
I think it's something that we, of course, in civil society have to be vigilant about ensuring that the voice of those who are not necessarily represented at policy tables is heard. And that is a constant struggle, because it is one thing to hold a public consultation, is another thing to indeed listen and act on, in fact, what is put forward. And I think that is one of the reasons why the Antibiotic Resistance Coalition will be quite selective in what consultations it will be focusing upon, because in some cases it's for show and tell and not necessarily for translating into actually effective policy action. And if we're not going to, we should be focusing our time on where we can make an effective difference. And there are many potential theories of change and avenues by which actually civil society and the talented members of actually the Antibiotic Resistance Coalition globally could act on. And that's where we need to focus our efforts. And not all of them will be actually in the global level. Many of those efforts should start really now getting to the real concrete strategies that we need on the ground, piloting those approaches, and then lifting them up for global consideration. It should be in some ways driven by what we can do effectively and demonstrate, not just necessarily being led by principles that oftentimes in some ways now are beginning to sound like they're repeated over and over again like a chant, not necessarily an action that to move forward. So we need to have a lot more actually accountability for that.
Right. Also, Dr. So, I understand that a lot of the civil society bodies within the ARC come from the LMIC, represent the Global South. So if I can now bring this discussion towards LMICs, what do you think are the efforts that is happening at the global level? Are they aligned to the needs of the LMICs, which is likely to be heavily impacted by this by the AMR issue?
You raise such an important point. The globalization, of course, of people, trade, and pathogens or superbugs themselves, of course, makes antimicrobial resistance everyone's business. But the way we address antimicrobial resistance has to reflect these differences in local context. Yes. And so let's just lay out initially how challenging this can be. By the World Bank's own economic projections, the economic toll would clearly be disproportionate upon low and middle income countries. We anticipate that, in fact, if unchecked, up to 24 million more people would be forced into extreme poverty by 2030. Now, under the high impact AMR scenario, there could be as much as a 3.8% loss in annual GDP by 2050. That's an annual shortfall, $3.4 trillion by 2030. So we talk about, of course, the challenges that we've seen this past year. Think about this as a sustained challenge actually over time through the lens of antimicrobial resistance. And interestingly and importantly, the greatest economic losses, of course, will befall the low-income countries. Now, it's fascinating that how actually we can make the case for investment, because the World Bank projects that we do invest to contain antimicrobial resistance. Low-income countries, of course, will see substantial economic payoffs, but the greatest absolute and per capita gains would flow to upper middle-income countries and high-income countries. This is the most compelling case that we should invest now Or because it is, as I remember, we said upon the release of the UN Interagency Coordination Group's recommendations, we said it's really a question of pay now or pay much more later. And I think that this is the kind of investment that is compelling to make today. Look at the failure for us to invest in infrastructure for prevention of the next pandemic. And just imagine, though, this rising tide of antimicrobial resistance creating the same kind of actually repercussions, but over decades long actually periods of time. This is the type of actually issue that our policymakers must begin to understand. You know, the sad thing is, of course, you know, we have many countries signing up for national action plans, you know, faithfully following through on the global action plan on AMR, the adoption by, of course, the World Health Assembly of such an effort. But if we look at, of course, the survey that the World Health Organization conducts, of those that actually say they have national action plans, I think it's about fewer than 1 out of 4 have funded them adequately. So, you know, this is a significant challenge. If you have essentially the means and the measures must be commensurate with the mandates, you know, and we have little in the way of intersectoral guidance. You know, does a country policymaker invest in antimicrobial stewardship in the hospital or in the community, in food animal production or in foodborne infections, in vaccination or the supply and use of antibiotics? There needs to be a much stronger set of frameworks by which we can guide and support the most strategic and value-added interventions in these various settings. And we need to also mainstream AMR into development, into universal health care, into water, sanitation, and hygiene, or WASH interventions, into our vaccination campaign efforts, and of course, into the response to COVID-19. So much as I'm in favor, of course, of vertical attention on antimicrobial resistance, we know that the answer also has to be horizontally integrated to these other movements, to these other efforts, to really make it relevant in these settings. After all, underuse, not just overuse of antibiotics, has to be considered in these settings, right? I mean, we're talking about 700,000 people suffering essentially from dying each year of drug-resistant infections, according to the UK review on AMR. But it's also true that 5.7 million people actually die from treatable infections each year, mostly in low and middle income countries, mainly because, and oftentimes because they lack access to effective antimicrobials. So this points to the issue of underuse. And that's equally important to acknowledge and of course to build into our plans to address antimicrobial resistance.
Right. So what I understand is there is this concern with the access versus excess. This is going to be there, and this needs to be looked up very strongly, particularly in the context of LMIC settings. But how do you think, what is that one change in thinking maybe that is needed, you know, to turn things around? I know it's not one thing, but not one exactly. But if you would like to talk about one prime thing that could be changed, that you would like to change in order to maybe turn things around, and also can we derive from learnings that we have had from other global challenges? What are your thoughts?
That's a great question. I wonder if I can have two. But so let me just start with the one, of course, that particular CSE I think is very engaged in, which is, of course, making the One Health approach to AMR real, integrating environment into our thinking. After all, as I point out, most of the antibiotics that humans and animals consume ends up in the environment. And we really have a very poor understanding of how we best actually not only track and trace the flow of antimicrobials through our environment, and where does it create the greatest challenges in spawning new emerging infectious diseases. But we also need to figure out, of course, how can our systems, both in healthcare delivery and in the food system, better, in fact, not rely on antimicrobials where in fact is not necessary. And this involves a lot of interventions that could be made across the value chain. You know, we could actually, for example, for medical instrumentation, decrease actually the frequency of infections that that surface in our hospitals. If we could develop, for example, possibly new surfaces to medical instruments that were resistant to actually bacterial colonization, that actually are not so susceptible to the kind of biofilms on which bacteria then actually enter the body through medical instruments that are used in hospital care. We could actually have entirely different ways in which we have more sustainable agroecological approaches to raising, of course, livestock, in which lower animal density could decrease the transmission of diseases, including not only among the animals themselves, but between animals and humans. And so again, these are the kinds of things that we should look for, and many of these have co-benefits. So it's entirely possible to imagine that if we much of, for example, the antimicrobial use in food production is driven by the increasing demand for meat consumption. So if we could, in fact, have a more plant-based diet, which would have health benefits, there could be the co-benefit as well of decreasing this driver to the use of antimicrobials in food animal production. So there's a lot to be done just in that area. I would point out too on the healthcare delivery side, since so many people are more focused sometimes just on antibiotics in our healthcare delivery system, that we need a more end-to-end approach to antibiotic innovation. Now, civil society was instrumental in pushing the idea of delinkage earlier, where in fact, of course, we faced, really the contradictions between our economic model of bringing antibiotics to market and the biology of resistance. After all, if we incentivize a drug company to sell more antibiotics, to actually raise more revenues, then their, of course, interests are at odds with the appropriate use of antibiotics, which may require stewarding it so you actually use less antibiotics, but it might mean less revenues to the drug company. So if we could, in fact, change that dynamic and de-link, as we say, the return on investment from our R&D, from the volume of sales of the antibiotic, that's a key starting point. But we need to go further now. We know now that, in fact, drug companies are poorly actually positioned to control actually the delivery of the effective and appropriate use of antibiotics in the healthcare delivery system. After all, that's really the province of doctors and patients, healthcare delivery systems. And so we need to find a better way of integrating and aligning these incentives. And then we do see, of course, some interesting models emerging, but there's a lot more work to be done. As far as, of course, lessons, we have a lot of lessons, of course, to build on from other movements. And I would say that a lot of the communication lessons to the public on risk perception, a lot of the efforts certainly in actually trying to use tools like pooled procurement, which we see now, for example, in tuberculosis, which is certainly an antibacterial drug, but kind of different than the traditional probably antibiotics we might use for urinary tract infection or pneumonia or other conditions. Interestingly, in that area, the Global TB Drug Facility has shown us that you can use, by pooling procurement, you can actually be well positioned, both to affect the supply chain by ensuring that actually manufacturers have the appropriate incentive and see the demand for antibiotics, which are sometimes in short supply because they don't get as much perhaps revenue off of it. And at the same time, enabling effectively some control over actually how these antibiotics that are procured can be used effectively in the healthcare delivery system. Sitting at that vantage point, they can also make sure that the prices of those antibiotics are affordable to those in need. So again, we have entities like that that we can build upon the experience of. And of course, during COVID-19, there are going to be many lessons we would imagine as we, of course, struggle with turning back this pandemic that we can build upon, because we are learning in real time how to deliver new technologies essentially to people in need. And there will be a lot to be done properly there. And hopefully we can build upon all that for also the work in AMR or antimicrobial resistance.
Right. So, Dr. So, what I gather from the last bit of, there has been so much information sharing between the last couple of minutes. What I gather is there is a lot of work to do. There is still a lot of work to do, and possibly the theme of this initiative, which is Act on AMR, suits well. It's 5 years to the release of the Global Action Plan, 5 years to a lot of governance and policy making happening. Good things are happening, but then we also realize that there are areas that need focus and that need more attention, and more so in the developing country context. And if I try to close this, Dr. So, and bring to a summary, there are a couple of very good things that you said. Of course, while we have looked at gaps and challenges, but I would like to understand and maybe say that a lot of good things are happening. there is opportunity around, there is scope, and we will have to weave things into all of this to be able to come out with solutions and talk about solutions. Like you said, talk is cheap and action takes more. And there's also one very nice thing you said, which is pay now or pay much later. So I've been capturing all of this, which somehow summarizes this entire effort, global effort, that is happening on policy making and governance to be able to contain AMR. Um, Really nice talking to you, Dr. Anthony So, and we are grateful that you have enlightened us with information, with thoughts that we can you know take cues and continue to think about. And we hope that stakeholders who watched us today, who have heard us, have takeaway messages, have takeaway areas which they can focus on, which they can go and delve upon, and even dig deep and find out what is happening. Of course, there are limitations, there are challenges, but that should not become a reason for the world to stop. Particularly so when COVID is also there, and we are fighting against it. The world came together to fight against COVID. So why not the silent pandemic of antimicrobial resistance? Uh, Thank you so much, Dr. So. We're really
Well, thank you
pleased.
so much for the opportunity of joining you today.